I think we might continue to have some individuals joining us as we go along, but let's get on with our wonderful masterclass that we have scheduled today. Hello to everyone. My name's Amanda Rushbrook, sorry. I'm the head of Alumni and Supporter Engagement at Kingston University. So thank you all for taking time out of your day today to join us. Our Upgrade Masterclass series explore different topics for professional and personal development, and it's a wonderful opportunity for us to join together alumni, students, academics, and friends of the university to share insights and ideas. So just before we begin, I wanted to mention some housekeeping notes. This event is being recorded. And as I have mentioned, we ask that you kindly keep your cameras off and microphones muted for the duration of the event. This will allow us to have a clear view and to hear our panelists more clearly. So thank you if you could turn those off now and make sure you're muted. So questions can be posed at any time using the chat function. And those will be read during the Q&A if time allows. So without further ado, I would be very pleased to hand over to today's chairwoman of the masterclass, Professor Kathy Curtis.
Thank you, Amanda. So may I warmly welcome my three fellow panelists and all of you joining us for this very topical masterclass on International Nurses Day. We're going to start with panel introductions, followed by a panel discussion on compassion and self-care in the caring professions. And then we'll open to all of you for further discussion, comment and questions. So I will start off the introductions. I'm Kathy Curtis and chair of the panel, as you've heard. I'm a professor of professional development and an intensive care nurse who's worked for over 20 years in clinical practice and another 18 years in education and research. As you can imagine, critical care nursing involves highly emotional experiences where the very sickest patients are cared for to recovery or to reach the end of their lives. It involves working closely with patients' families and other loved ones, and all this takes its toll on the caregiver. My research over the last 15 years has explored professional development in compassion, how nurses are socialised into compassionate practice, and how they can be taught to provide compassionate care whilst also looking after their own emotional well-being. Compassion requires getting to know and understand the suffering of other people and then acting to try and relieve that suffering. It therefore relies on many interrelated factors, such as having the time to get to know individual suffering, knowing how to relieve that suffering, and having the capacity and the capability to act to relieve that suffering, while at the same time being careful not to take on the suffering of patients, so the carer ends up suffering alongside them to the point of emotional exhaustion. Being compassionate is influenced by those around us, such as role models and leadership. Workplace leadership has a powerful influence on the working environment and on staff expectations for compassionate practice. Now, this last 14 months, COVID, has put enormous pressure on many caring professions, not just nursing. Enabling staff to provide compassionate care during the pandemic, alongside looking after their own well-being, has not been easy. There is no doubt some staff now need extra support to recover from the emotional impact of their roles during the pandemic. And opportunities for talking and reflecting with others who understand their roles, such as their colleagues, friends and family, can be helpful. I believe it's also important for staff to be self-compassionate and forgive themselves for the times when it wasn't possible to uphold the high standards of care they would normally uphold, and accept that they did their best in very challenging circumstances. So I'm now going to invite Dr. Hazel McLaughlin, please, to introduce yourself.
Thank you very much indeed, Kathy. And I echo some of the points that you've already made around self-compassion and also the importance of leadership. It's really, I want to warmly welcome everyone to this event. It's a pleasure to be invited and be part of this panel today. I'm really delighted to represent really on two levels. One as someone who is an alumni of Kingston University, but also as past president and president for 2020-21 of the British Psychological Society. So I'd like to bring the kind of psychologist perspective to today's talk. And when I did my research at Kingston University, and it was pre-COVID, I did that on relational power, how you actually make the most of relationships. And that is just so important when we start to look at issues like compassion and self-care, because it is about the dynamic and people together. I'm an occupational psychologist by background and the MD of More Smart, and what we do is look at leadership, change and growth, and particularly also thinking about executive leaders and how they can optimize things. So to give you an idea of that, I worked with the NHS over a number of years, and one particular project was around coaching the chief nurse and the chief medical officer to work better together and in a more compassionate way. And that's particularly relevant in International Nurses Day. In terms of the psychologist, I also want to make a couple of points. Psychology is a broad discipline, and one of the upsides of the pandemic has been people starting to work together and break down silos. And I've certainly seen that in many professions. But there's also an increase in mental health issues, and people feel isolated. They feel concerned about the level of anxiety, and they feel concerned that maybe they're the only one that feels like that. And I want to just emphasize today that, in fact, we all feel much more isolated. We all feel more anxious, and all the research shows that those sense of feeling where is everything at and how am I going to move forward is just a part of this pandemic. The other aspect that I'd like to highlight, and I'm sure some of my colleagues will as well, is that there has been inequality in the way in which the pandemic has been experienced. And I'm particularly concerned about disabilities. We know that, for example, recent government research suggested that people with disabilities are far more likely to be worried about what's happening with COVID. 83% of people had experienced that, as well as the impact in terms of well-being and welfare. So I'm really looking forward to our discussion today. I'd like to also emphasize the importance of compassionate leadership and being compassionate about ourselves. Thanks very much.
Thank you, Hazel. Valentine Wesley, would you like to now introduce yourself?
Hello, my name is Valentine Wesley. I work in health and adult social care at London Borough of Croydon. I'm head of service for adult mental health social care. It's really a very interesting place to be today. I'm privileged to be invited as a panelist. And the topic itself is something that resonates strongly in the work that we do, compassion and self-care, care and profession. And as you know, that's what social work, mental health intervention is all about. But it's an opportunity to discuss around pertinent issues that I think a lot of people here in psychological background will understand when we're talking about the emotions behind the mask. Talking about individuals, whether they're professionals, whether they're clients, or whether they're families and friends, and how they cope through very difficult situations. But to give you a background to the local authority that I work for, Croydon is a very vibrant, multi-ethnic local authority. We have a population of about 386,000 in the census around 2019, which increases by 1.02%, and is the second highest in London. And the further data we have is that 238,000 of those are aged between the age of 18 and 64. And those who are over the age of 65 are about 53,000, which is third highest in London. And 61% of our population are also from non-white Irish ethnic background. And also listening to what people have been saying, the importance of self-care and compassion can be seen as a remedy or support in terms of the approaches that we use in mental health, in recovery and support. And given the fact that Croydon accounts for a high proportion of people in long-term support, which is about 2,995. And out of this figure, 1,460 people are in long-term support because of mental health reasons. So in a sense, talking to my colleagues, we are from mental health and social care perspective, there is a constant arrangement, so a constant focus around the interface between what adult social care is meant to mean for people and how does that translate or engages with mental health, and what is the role of practitioners, whether they're professionals, whether they're informal carers, and how do they support people through their journey, showing compassion and being mindful of their own health. In COVID, we have seen deaths of colleagues, family members, infection, sickness, fear of vaccines, tests, long-term illness coming from COVID, work pressures, and as my colleague mentioned, isolation. And what came out from all this is those emotions behind the mask, which is worry. People are terribly worried. People are afraid. There is anxiety. There's a level of hopelessness in the height of the pandemic. There's a level of frustration sometimes, and people feel guilt and grief, anger, and a sense of also, there's a positivity in a sense of pride when people pull together to face challenges. But it's all about how we care for ourselves in such very difficult circumstances. So in a sense, it's for us, it's important in mental health as we work, and for all staff also in local authority, how we support people through the barriers of remote working and isolation, where we have to look at race and ethnicity, where we look at cultures and perspective of what people are afraid to share, where we look at understanding of knowledge of self, personalities, and how we support people to validate their experiences. So that's a snapshot of my contribution around this.
Thank you, Valentine. I now invite John Godden, MBE, to introduce himself. Thank you, John.
Thanks, Kathy. Hi, everybody. My name's John Godden, and I'm Chief Executive of Salutum Care and Education. We provide residential care and support for adults and children right across the country. We look after around about 1,500. We have about 3,000 staff to be able to do that. We actually are working quite closely with Kingston University. We are very proud to support two of the undergraduates in the social care sector, which is a real privilege. And we have a joint project with them to develop some smart technology to help with the front line of care. So my colleagues and I care for people with conditions from autism through to cerebral palsy, through to various types of mental health. And, you know, at the more extreme end of that, people that actually need residential support. And, you know, that's a challenge at the best of times. But the past 14 months getting through the COVID pandemic has really sort of magnified all of the issues that are normally at play anyway. I think going into the pandemic, Valentine's, you were talking about the fear, the trepidation of the unknown, and that's been relieved to some extent as we've understood more about what's happening and what to do about it. But from the perspective of a care organisation like ours, we were actually fairly well armed going into it, because infection control is something that's with us all the time. You know, we have people who are very, very prone to issues of health, even if their mental health is their primary diagnosis. Often that is accompanied by fragile physical health. So we've always had high standards of infection control. But nonetheless, that got tested to the extreme in protecting everybody from the pandemic. But it brought a whole new factor into play, which is that balance between the need to look after yourself as a carer, as well as the person you're caring for. And there is a long-held view that people who are devoted to the care of others sometimes don't take enough care of themselves, and that's something that we need to address, and we work hard on addressing that. And that was very, very much thrust into the fore when the pandemic first came into play, and people trying to work out how they were going to continue to care for the people that it was their professional duty of care to do that, but also care for themselves and their families and keep everybody safe. And that's a lot of stress. It's a lot of pressure. And, we had to work out how to relieve that, how to enable that. What were the important factors in ensuring that people were able to fulfill what they wanted to do every day in delivering the care to the people that they support, but do that in a safe way. And I remember back in March, April, May last year, that was very, very difficult. We didn't have the tools that we now have. We didn't have the vaccines. We obviously are already users of PPE, but nonetheless, that was all having to be used to a greater extent. And there was a real balancing act between making sure people were safe, but not getting too burdensome about it and allowing them to do the one thing they really want to do. And this is always a common theme across the various care platforms. The people who are in this sector, their primary reason for being there is they want to care. So we had to enable them to continue to care despite the new challenges that were presented. And mental health was a big part of that, as well as physical health. Anybody who had any fragility to their physical health needed to be protected more than others who were in more normalized health. And we found out an awful lot about our colleagues that perhaps we hadn't appreciated, about how we needed to look after them, look after each other, because COVID, as I said, just magnified everything that was already at play.
Thank you, John. I think it's very obvious to me that my three fellow panelists have got a lot to contribute to this topic. So thank you for those introductions and initial oversight of this care and compassion agenda. I thought I might start our panel discussion by asking Valentine, you first, if I may, what have you seen to be the biggest challenges for compassion and self-care within the social care services, within social work and social care?
I think the biggest challenge is, especially through COVID, and as John said, everything seems to have been magnified, is in terms of resources. And when I mean resources, I mean people, not necessarily the finance behind it. Having people well qualified, being able to support those who are in need. I can give you an example. In adult social care and mental health, and as we mentioned, there is significant impact on people being able to qualify to these positions to be able to take up the professions. And because of the high emotional resilience required to deliver care in the right way, it means that, if I use the term, the shelf life or the professional life of people in delivering care is often quite reduced significantly. And people leave the profession because of the challenges in it. There is a lot of work needed around what someone mentioned, leadership, around motivation, around inspiring, around encouraging, around looking at engaging with different ways of, having a very good boundary between work, family life, health, and keeping as priority the things that are most important. I think there is this terminology that you're not good to anyone if you're not good to yourself. And again, that is most important. But and also when we work in our profession on a daily basis, we engage with individuals. People don't usually come to us because they've won a lottery. They usually come to us at the darkest period of their life, where they need support, where they need someone to listen to them, and not having those support available at the right time, in the right manner, or the right support is always a big challenge. So, and it has impact both on our staff, and it has impact on the clients that we serve and the communities we serve. Our response to that is to move out closer to the communities, to get to know our communities better through what we call locality place-based working. To have professionals working very close to individuals at different points where they engage with health or care, so through their GP practices, in their libraries, in their local communities, getting to know them, getting to understand what, and trying to break down these barriers. But again, that requires a lot of resources to be able to meet their particular challenges.
Thank you, Valentine. I'd like to pick up on that point and invite Hazel and John to comment on this. This is leadership and leadership that enables self-care, staff to care for themselves. So perhaps I could come to you, Hazel, first, if I may.
Yeah, absolutely. So, I mean, leadership is fundamental here because as much as people who are colleagues can support each other, the problem is that if the structure and the process and the leadership isn't there, it's very difficult to make the time or to have the permission to have the time to really care for others around you. And compassionate leadership, you know, came into the NHS and into the care professions a number of years ago. But in fact, over this pandemic period, it's been even more important. And this is about truly understanding what's going on for individuals. So when we talk about people being authentic in work and bringing their whole self to work, we're really thinking in those environments about enabling them and giving them support. And part of that also comes from values leadership. It comes from having very clear values about respect, about trust, about enabling people. And it's easy to use those words. It's not so easy to actually implement them. And when people are in that rush situation, you know, there's a lot of patients to deal with, there's a lot of issues to deal with, and everyone's trying to run at 100 miles an hour, it's quite difficult to truly live the values, to truly ensure that that trust and respect is there. The other factor that I think is really important here is psychological safety. And many people are really experiencing situations where they don't feel as psychologically safe as they might do. And often that may be a function of being isolated. They might not have much contact with their work colleagues for various reasons, if it's remote working, or it might be that the environment is so pressurized that it's very difficult to operate within that. And I think the third element that I'd highlight is about the need to be much more agile and flexible than we've ever had to be. So there's often been processes in place, but actually you just can't get everything done, or you can't treat all the patients if you can't just sort of be a bit more flexible and a bit more agile. And increasingly organisations realise that they have to enable that, and style of leadership really needs to make that happen. So when we talk about resilient organisations, we can't have resilient organisations if we don't have those foundations in place that really enable leaders to encourage and to enable other people, and the agility to deliver the end results.
Thank you, Hazel. I mean, John, you're a leader of a large caring organisation. What are your thoughts?
Well, you know, there's a lot of discussion always when you go through these things about the need to support all of your staff and to have them valued and enabled, and also, you know, to ensure that they understand that it's okay to not be okay. And that's a very mental health focused slogan, but it also applies to physical health as well. And the leadership have got it within their power to really make a difference on all of those issues. And it's no good just to say, well, we want to value our staff. We want our staff to feel trusted and enabled to be able to, make the micro decisions that make a difference every day, to be flexible around care. The leaders need to make sure that structurally that can all happen. And communication is very important. And of course, we've all had to learn new, better ways of communicating. And I do have a view, actually, with a geographically disparate organisation like ours, communication has actually been enhanced over the last few years. Over the last year, people have been forced to address how you communicate all of the fast-moving advice that was happening around managing the COVID pandemic, but also really having two-way discussions going on between the leadership and the frontline staff, because the frontline staff were having to deal with new things that were coming at them very quickly, and good leadership needs feedback loops from that. So the communication around that is important, not just in terms of making sure everybody understands what they got to do, but it also has a very, very solid impact around well-being and mental health. I have a title which is Chief Exec, and it is quite a powerful tool if used properly, that people, if they feel they have access to somebody with a Chief Exec or a Managing Director title, it really can contribute to making them feel valued, listened to, and a key member of a staff team. And that's very, very important for their well-being, that they do have a voice. But there's a lot of components to this, and you can't avoid one of the key ones, which is pay. And social care is always a sector where this is a challenge. And you can't divorce yourself from the reality that it is not only a reflection of worth, but it's also an enabler to live, for people to live lives and get things done. So as leadership, we need to ensure that all of these components, from pay to communication to career progression enablement, all of those things are there in place and really lived and understood. There's so many organizations put their value slogans on the wall but don't truly live them, and when staff actually need to to pull a value, whether that's the company giving them some sort of compassionate leave or some sort of flexibility, or supporting them in some way, having it written on the wall is not good enough. You've really got to live it, breathe it. But I think another thing that leaders need to do is they need to demonstrate that we really are all in it together, and that needs to be done in practical ways as well. And that can be anything from getting involved in the front line when we have resourcing issues, and I think a lot of leaders have been called to do that over the last year, and good leaders should be prepared and make sure that happens. But also to share the fact that we are also subject to the same issues as well. Some of my very senior colleagues have found the last year very difficult, and we've shared that. We've shared those mental health challenges, those difficulties, those fears that we've had, and we share that with our staff. We suffer from those things as well, and we need as much support, care, and compassion as anybody else does. And we do find that those sorts of things really help.
Thank you, John. Before we open up to general questions and discussion with our guests, I'd like to just take it down to a more granular level, if I may, and ask, and possibly this is a question for Hazel to tackle first. How, as individuals, can we really try and help ourselves recover from what has been a very difficult 18 months, 14 months, and some of the emotional exhaustion that individuals may be feeling at this point in time?
Yeah, absolutely. Well, different people respond in different ways. So I think there's no simple answer to that question. But I think there are some things which are really, really important to think about. The first thing is to recognise that it is all right not to feel all right. And I know that comes back to the slogan that John's using, but that focus around if you feel a bit down, it's okay. If you are a bit anxious, it's okay. It's manageable to move things forward. The second thing I would say is just really making sure that you chunk things a little bit more than build them into a bigger problem. So very often people look at things and they think, oh, wow, I'll never get through all of that. But if you chunk it into pieces, it's much, much easier to tackle and easier to get through when there are challenges. And the third thing is really about this work-life balance, and Valentine's already sort of highlighted this with his staff, but people have ended up working virtually all the time because they never switch off. They don't have that period of travelling to work in many cases, or they're rushing from one thing to another. They're also unable really often to sleep well, and we know from the research that there's an increase in changes in eating habits, more alcohol consumption, less exercise, all the things that make our well-being better. So, you know, having non-screen time is really, really important. Switching off, going out, nature, getting an opportunity to go for a walk in an environment that is slightly different will enable and help people. So I think recognizing it and then taking some small baby steps that enable you to actually feel a bit better.
Thanks, Hazel. Valentine, did you want to add any comments to Hazel's?
I do. I think one of the experiences we've had during the pandemic, it's about being open and honest about your circumstances and not worrying how you'll be perceived if you're able to explore your experiences, or worry that you'll be judged by your colleagues, or thinking that you're being dramatic, and as leaders, it's our role, which I've found, is to validate those experiences and support people through that journey to become more open, and also creating forums where people can meet more because people are very isolated. And again, looking at the sources of comfort is different from person to person. For some people, it's the comfort they get from their family and friends, but also from others, is the comfort they get because they spend more time in the office than they do at home. So making an effort to create a work environment built on open trust and safety, where people will get that support from their colleagues. Some people, it requires a lot of bravery to open up. It requires leaders to create that trust and safety for people experiences to be used to encourage them and to support them. But for also practitioners, it's about, there is an element of people trying to hide themselves behind that mask. And I understand, and I think a lot of people have already said that it's okay to be that way. It's okay to feel the way you're feeling. It's okay to share that experience with your colleague, and it's okay to talk to your manager. In our workplace, we've designed those forums. There are some forums, internet forums, that we've designed, not necessarily because we are focusing on work, but we're checking in on people and wherever they are, talking to them. And also, I don't want to underestimate the power of kindness, the power of making that effort to reach out to people, the power of observations of what is happening around you, the power of doing that little bit, offering that little bit of support. I know making coffee or doing things for others, or going out of your way to support people, or even phoning people when you haven't heard from them. There is an element of, for some people who are very ambitious, there's also the issues about relentless drive to achieve and try and see how that equates to your own self-care. And I think John has already talked about people in responsibility and position who often think that they are immune to this. And hiding their difficulties behind that mask, and being able to have mentors who they can share those experiences with. And again, what we give is what we receive in a sense. So getting that support will help us to be able to provide support to others.
Thank you, Valentine. John, I'm going to finish with you before we open up to questions. And including any comments on what's just been said, perhaps you might be able to illustrate to us any, public or workplace type procedures and policies that can help with this.
Yeah, it's an interesting issue because we've been through a very difficult time, but a lot of what the people in care organisations do is difficult anyway. We're looking after some people who are very, very challenging, have challenging behaviours or challenging medical issues, and that's constantly difficult, but has an incredible upside when you do it right. I mean, the joy of care, of a great, when you have a great outcome, is a wonderful, wonderful thing. And for all of the sort of negativity around having to work more, we had at the worst, we had something around 17% of our workforce unavailable because they were having to isolate due to people having tested positive and whatever, or because they had they were clinically vulnerable. So that obviously brought a lot of pressure on those who were able to work. So had those issues. We had services that had small outbreaks of COVID where we locked the service down, and the staff, I mean, incredible staff. I mean, they would lock themselves in for multiple weeks with the people they dealt with, that they were looking after, and they would live them, exposing themselves obviously to COVID, but divorcing themselves from a period from the rest of their lives. And that all sounds quite negative, but actually there was a huge amount of positives came out of it. Care as a profession has been thrown into a very, very positive spotlight, and it has had a very positive impact. People are feeling better about it, more recognised about what they do, and there is some sort of coldness to it in that we've got people that work for us, and perhaps a lady might be a manager of one of our locations, and her husband might have been working in the restaurant sector, and he lost his job and she kept hers, and that's quite a brutal sort of scenario, but there's a real joy across our company about what they've achieved over the last year, and getting through it well. I mean, incredibly, we didn't lose anybody that we care for, or staff members, to COVID until sadly the first week of February, and we did lose a couple, which is for an organisation like ours something we're very proud of, and everybody shared that pride. But they do feel like there's a higher level of recognition for what they do. They've shared a lot of the experiences of lockdown with the people they care for, and the people in our services have had to endure a lot. A lot of the things they do in their normal lives have been curtailed, but are now coming back, and there's great joy in that, shared by by staff members as well. So I'm not sure we necessarily see in our sector, and it's very different for office workers and others. I don't think we fully see that we're suddenly going to be breaking out into the sunlight and the fresh air. We've kind of been there for some time, and that's been quite special, and has been reflected in everybody's view of themselves and of their life as somebody involved in care. So it's not been entirely negative, but we still recognise that we do need to do more. But I don't think we just see this as an event where we just try and look at doing things now as a one-off. It's part of a continuum of trying to make care as an experience a better and better thing, both for the giver and the receiver of care.
Thank you, John. I'm going to open it up to questions now. And Amanda, I can see from the chat box that there's been a lot of activity. So, I'll hand over to you now, if I may.
It's been very busy indeed. And I think there's a number of people in the healthcare industry and social care who are really hearing what you're saying and have been through a lot. There's exhaustion, but there seems to be a real sense of people are kinder, more compassionate and understanding. So there's lots of virtual hugs and high fives, I think, going on in the chat room, which is absolutely deserved. What I'll do is there's 3 questions that kind of follow on what you were just talking about, and maybe if there was anything else to add to these, but they are talking about people struggling, even if their job is face-to-face and getting others to open up. What can they do to be honest about their own feelings when they really struggle to do so? And it kind of goes into the idea of also leadership, or those who are in the position, how can they get the message out to enable exhausted care for professionals to get the support available to them? Excuse me. And then finally, I don't know if that can kind of also speak to how do we avoid burnout and reduce turnover of caregivers? You spoke a lot about these areas, but is there anything else you'd like to add to it? Because that's the bulk of the questions out there.
Thank you, Amanda. Hazel, could I start with you on that?
Yeah, I mean, I think what's interesting is that, of course, it's not enough just to have a policy that says we're going to make time for people, because people don't make use of that. And so it needs to be an active, ongoing process. And that means, you know, when we first meet somebody in the day, we're actually genuinely asking them how they are on that day. We're not just making the assumption they're going to be fine or the same as yesterday. So I think it's all about communication and enabling people to have short breaks or short times where it's a checking back kind of process. And burnout happens when we're overstressed, when the demands are so high and we cannot actually make it happen. It's just impossible to do. So we need to give people respite, and to give that respite doesn't mean just enabling them by a rota or by a process. It's actually about genuine care. And that means, you know, that little look, that little glance of, are you really all right here? Can we make something slightly different for you today? And I think the idea also of stigma is important to bring up. We haven't really brought that up, but we talk about people enabling them to talk about their mental health. But actually, we need to really live that in the values that we have in our inclusive culture. And so when someone raises something, genuinely being empathic, taking the time, even if it means putting something else to one side, just for that time to make things happen. So it's little and often is really my message in here.
Little, often and genuine.
Yes.
Is what I got from what you were saying, Hazel. John, can I come to you for your response to the questions?
Yeah, I mean, I love that. Little and often is fantastic, and it is, you know, very often it's that really is the little things that make the biggest difference. But it is cultural. It's, you know, it is about really believing that you can make a difference and do it properly. And if, you know, there's a lot of tools and there's a lot of structure that you can put in, but if you're not really trying to make a difference, you know, nothing you do is ultimately going to work. You know, and we wrestle with the issue that people are so devoted to those that they care for that, you know, getting them to step back is problematic in itself. And it is, you know, we can program it in, and we can, you know, have helplines, and we can ensure that they're getting the breaks. But in reality, it comes down to making them comfortable enough and have enough trusted colleagues around them that they can let go for moments. And that's really important. So what we can do is, you know, we need to make sure that we are appropriately resourcing everything, you know, having low levels of staff resource. And, you know, ultimately our whole business is people looking after people. I mean, you know, the resource is people. So we need to make sure we got enough people, and that is about culture and pay policy and all of those things coming into play, and that's what supports the colleagues. You know, we all care so much. We don't want to leave the person in our care we don't want to leave them in a vulnerable state. So if there's nobody to take over the shift, well, you know, you'll do more hours, and that's where burnout really sort of comes into play. And we also get this situation where people need to earn more money, so they do more and more overtime, but actually we just need to pay them more for the hours that they do, and make sure they get rest, and make sure that they're trained appropriately so they can be efficient and confident in what they do, because that's good for their mental health as well. But yeah, it's, you know, it is a difficult thing, and it's much more cultural and value led, and educating people to worry and care about the things that they can affect, and let go on the things that they can't. And you know, we're in a very heavily regulated sector, and there's always that pressure coming from the regulators, you know, which you can't avoid and you can only encourage. But you know, this forgiveness, I think, is a useful thing, as long as people are kept safe. And it is just making sure that people understand that you can't do everything all of the time. You do your best, you give of your best, but you really should only do the things that you can affect. And there's no point stressing about things that you have no ability to do anything about or impact. And I think if you get everybody to think like that, everybody's load is lightened considerably.
Yeah, I mean, I've got to completely agree with you, John. From my own research, it was very clear that the ability of people to forgive themselves and say, look, I'm human too, and I'm suffering, and I need some help.
But just to come back, can you imagine this? You know, when we had a couple of the people we care for who passed away from COVID, can you imagine how that felt for the staff? You know, and our services are small, and we care for people for whole of life. You know, we have people who've been in our services for, you know, decades, and there's a real closeness and a real family. Can you imagine how they felt when they lost those couple of people to COVID, and the internalized blame and all of those things that are then apparent, and you have to hold them, support them, and educate them that you did your best. You know, there was nothing else. You absolutely gave of your best, and it was just something that was without your control. Celebrate the things you did well, celebrate the joy you had with those people, but don't beat yourself up because ultimately you were unable to prevent the thing that happened.
Yeah, absolutely. I can see a comment in the chat about confidence of managers to be able to support their staff with, you know, the emotional aspects of their work. And I wondered, Valentine, if you had any thoughts on that. You know, how do we enable our leaders, that those that are taking this responsibility for groups of staff, to develop that confidence?
I think it's the responsibility for that lies with both the individuals, the employers, and their line managers. But an important factor around that is about setting the tone and the direction, and changing the narrative, and creating the space, and creating the environment, and providing that support to managers to be able, in health and social care, managers can, because again, I mentioned before about resources, you have teams, a number of teams who previously would have different lines of management, but they are kind of condensed under one line management because of cost savings. There has been some proposals in the past in different areas about managing across boundaries, across specialisms, sort of things. But having said that, what has been healthy in my area is creating opportunities. We have what we call reflective forums in mental health, and we've increased the number of reflecting forums where individuals can come in, irrespective of your responsibility, your authority, your management level, and they feel free to share their experiences. And if managers are able to do that, staff follow suit. And one of the key action around reflection is about, why do I do what I do? It's also about changing the narrative about, in terms of, do I find this role to be meaningful? And a lot of people come into caring profession because they want to care. But at some point, the challenges that they face means that they are frustrated and they get upset and they get angry. So they have to, there is a requirement to change the narrative around how do we celebrate those meaningful achievements that we have in people's life. I know it's difficult sometimes to find those, but someone said something like, when life is measured by back-to-back Zoom meetings, even taking a shower can seem like a win. So we can find small things in our work where we can celebrate a win, where we can find meaningful purpose and sense of direction. And that actually helps the burnout. It means the managers who have a different narrative, and you can't do that without creating the time within the busy work that we do to have those conversations and those reflections.
Yeah, I completely agree. Being very mindful of time, I can see there are quite a few questions and comments in the chat that are very interesting around the role of arts in this, and all sorts of other things that we possibly haven't got time to focus on right now with less than 10 minutes to go. But I did want to say that, my email address is available on the Kingston University's website. If anybody has any very specific questions around care and compassion and self-care, I'm very happy for you to email me. But we are at the point now where I will probably suggest that, we have a hand up. So I will take the hand that is up. Let me just see who that is. It's a guest. So I don't know if you can see who it is, Amanda, but I can't see the name. But if you want to ask your question and turn your camera on to ask your question in person before we do our final wrap up, I'm very happy for you to do so. I don't see, maybe it's an accidental hand. Okay, well, in that case, because time is tight, I think what I'll suggest is that we finish on some final thoughts from panelists, and I'll kick it off with a comment, really, which I think is this conversation needs to continue, and it needs to continue in your workplaces. It needs to continue with those that you work closely with, your friends and family. And I think talking is most definitely a way to enable self-care. But let me go to my very clever and astute panelists and get their final thoughts. So I'm going to start with you, John, if I may.
Yeah, final thoughts. Look, everybody's focused in everything we do right now on the COVID pandemic, and that dominates our thoughts. But I think you're quite right. A lot of the issues that have been highlighted here are forever. They're not just for now. And I do hope that something really good comes out of what we learned in the last year, that there is a much higher degree of recognition about mental health of staff, as well as those we care for, which is our profession. And I hope that happens, and I see signs that is happening, and I hope that doesn't get lost as we all get back into super growth, which we hear is happening out there. And there are a lot of great lessons learned, a lot of good practices that have come into play, and I think one of the big ones is I really genuinely believe that people are more comfortable now to talk about things that afflict them and affect them, and it's no longer if you've got a broken leg, you've got a broken leg, but if you've got something broken in your mind, that's to be discouraged and to be buried. And I think people now have worked out that mental health and dealing with stress and dealing with well-being are as valid, if not more so, than dealing with your broken leg. And I do think there's been a real step forward on that, and I would encourage everybody to continue that journey. We constantly question how we can do those things better. I think it's obtuse that the care profession shouldn't understand that it needs to care for its staff as well as those people that it's paid to care for. And we're very, very conscious of that. And you know, we need to do more, and we need to find out what works. But it is the little things, those lovely little things actually have an extraordinary amount of power, and it's different things to different people, as I think Hazel said. Some people get a huge amount of joy out of a 5-minute conversation with somebody. Some people get a huge amount of joy out of you know, being able to spend some extra time with a pet or another family member, or being able to engage in art or whatever it is. And you know, we need to encourage and enable people to get those little things that de-stress and make them feel good about themselves.
Thank you, John. Hazel, can I come to you next?
Yeah, and I'm very, so we've only got 2 minutes or so. So just 2 things I would say is, first of all, we don't need to be perfect. We just need to be compassionate and understand that other people are human too. And, you know, I do like those quotes that say that leaders don't need to be great, they need to be human. And that humanity comes through. The second thing I would say is, John's absolutely right. Let's hope that it's not just for the pandemic, but actually for life, in terms of the way some of those changes for the better can happen. And the last thing I would say is that we do have resources on the BPS, the British Psychological Society, in terms of we've put out over 70 different publications and webinars that are freely accessible to everyone. They're for the members of the public as well as for practitioners. So feel free to read out more, because I'm sure that you'll find some nuggets within that context. But thank you.
Thank you. That's very helpful, Hazel. And final brief thoughts from you, Valentine, before I hand back to Amanda.
Great. It's for me, it's all about the power of self-connection, the bravery to ditch the mask and open up. Leaders to be able to give that permission for that to happen. The power of kindness, be kind to yourself and others, and also the power of observation. Take time to see what's happening around you, around with your colleagues, with your friends, with your families, and celebrate your achievements.
Words of wisdom. Thank you so much. Amanda, I'll hand back to you. Thank you.
Here I am. Thank you so much to what, I mean, there were so many people having to run off to get back to work, but who were saying, let's keep this going, this interesting discussion, this absolutely essential discussion. So I hope that in whatever, you know, avenues we're taking after this, we keep this going. And I love that, you know, being kind, little and often, we'll all be taking that plus much more with us. So thank you to our panelists for all of their expertise and insights. There was a lot of interest in wanting to get in touch, and also interest in postgraduate studies in healthcare at Kingston. So for those attendees who are interested, do email alumni@kingston.ac.uk and we will certainly help you out. Or if you had questions that were outstanding, we'll see if we can get Kathy to answer those, or our panelists get those answered later on. We host upgrade masterclasses 3 to 4 times a year. The next one's scheduled for September. So do keep your eyes out for emails regarding the next event. We definitely hope to see you there, and we hope that you stay in touch with the alumni community, with the student community, and just be kind to yourself and of course others. So thank you so much everyone, and have a lovely rest of your day.
Thank you.
Thank
Bye-bye.
you.